ASAIPA, assisting its members every step of the way. Good morning everyone and all members, and welcome to the ASAIPA YouTube channel. Today we have Ginette De Villiers from De Villiers Brokers. Thank you for being here, Ginette, and thank you for answering some of our questions that we have received from our members. I think before we start off with all the questions, Ginette, maybe you can just give me some background about MC De Villiers.
Thank you very much, Tanya, and thank you to the ASAIPA members for this opportunity. I'm the co-owner of MC De Villiers Brokers, CC. We've been around since 1989. We've got over 20 years of experience in the insurance arena. We have a professional portfolio currently of 130 professionals that we look after, from ops and gynae to neurospinal, GP, dentists. So we've got a wide range of specialists that we look after. We have the ability to take away all your stress and administration burdens and risk exposures and manage your portfolio on an ongoing basis, including your renewal process. We act as the go-between you and the insurer at all times that you have the unnecessary stress of having to deal with numerous people, and we assist you with all HPCSA guidelines, including informed consent, minimum healthcare records, mediation clauses, practice management, and we are here to service you and support you. We have exceptional service and very good turnaround times, and have a strong relationship with each of our practitioners. Thank you very much, Tanya.
Oh, thank you, Ginette. I think as you can hear, we are sitting with a company that actually assists in various fields and assists with various matters as well. I think, and that is the most important for all our members, to have one company to actually assist them with everything. So we are going to start off with some questions, Ginette. Our first question that we do receive on a regular basis from our members is, what exactly is a consent form in a practice, and where do you actually need a consent in place?
So just before I answer the question, I'd just like to inform you that Genoa Legal Division has given us the supporting documentation for the presentation today. So all the information is shared from a legal perspective. The informed consents, when is it necessary and should it be necessary for a doctor to have informed consents? There are various forms of informed consents. There's clinical, there's surgical, there's financial. It is necessary for a practitioner to have an informed consent, and it is a dialogue between the patient and the client. It is not a tick box scenario where you tick off the situation and say, I've tick boxed everything, because that will stand you in good stead if you ever do have a claim or an error arises or there's an investigation.
Okay. On that point, Ginette, just on the content that you have provided, so it's basically your cover and to make sure that you have everything in place from a practice side.
Yes. So we also have a checklist of informed consents where a practitioner is allowed to use the checklist and the informed consent, and he can tailor make the solution for his own practice. However, he doesn't have to go out and get a legal opinion on it and pay a fee for it, because it has been written and advised by legal people. So they can strengthen it based on their practitioners and based on their own practice management, but they've got all the baseline to actually assist them to make sure all the aspects are covered in the informed consent. And it needs to be done on a regular basis.
As well, yeah. Thank you, Ginette. Okay, Ginette, one of our other questions that we did receive from our members was actually, when do you need to review your current consent forms that you have in place in your practice?
So if you've got a patient that you've already treated, you can review your consent form close to the treatment period of when the person comes into the practice. You also need to review the informed consent if there is a material change in the patient's risk exposure or the treatment plan, or if a long period of time has lapsed since you have signed the informed consent. You need to reconfirm the informed consent. It does not give you the right to use the consent on an ongoing basis. Or if there's a material difference in the risk exposure and there's a completely new diagnosis or prognosis or treatment plan, then you have to review the informed consent again.
Okay. On that point, Ginette, just for some of our members, is there someone that actually need to review that, or can they have their external companies or get their legal department or management who in the practice can actually review then?
So the insurer, and currently we're dealing with Genoa, as the ability, if there's a specific request on surgical, financial or informed, we in any account share it with all our practitioners, the templates of everything they can use. They're updated on a regular basis, but if there is a specific requirement, we as intermediaries will discuss it with the legal team within the organisation, and we will revert back to the professional within the 24-hour period.
Great. On that last point, if patients, do you need to inform your patients of the review of the consent, or do you only handle one side and then inform?
So you need to inform the patient at all times, and you need to keep a record of the informed consent and the treatment plan on file, and preferably you should be able to give the patient a copy of the signed informed consent and keep a copy on the client's record as well, for the safekeeping for both the practitioner and the patient.
Perfect. Another question from one of our members: when should I obtain a new consent?
It's important to obtain a new consent form when the time frame of when the initial consent was signed. If it's a short period of time, you could practically use the same informed consent if it's the same treatment and prognosis. However, it is recommended that you forward the informed consent to the patient prior to scheduling an appointment, that they can review it and bring it to the consultation.
Thank you, Ginette. Ginette, the last questions for this session, from our session today, is whether you need to have your consent form in writing, or can your consent actually be oral consent that you do give to patients?
You may have both, but it is highly recommended that you have a written informed consent, and that it's kept on the patient's file as well as given to the patient, because he has access to his own information. And should it ever be required, then the patient and the practice manager or the doctor has a copy of the informed consent.
Thank you, Ginette. Thank you for your time and all the answers on all our questions from our members. I want to thank you for visiting our YouTube channel, ASAIPA YouTube channel.
Thank you very much, Tanya. Much appreciated.
If you have any other question for Ginette and the De Villiers team, please contact ASAIPA directly, and we can ask directly for you and now get experts to come and answer for us. So thank you for tuning in, and please, we will keep you updated. ASAIPA, assisting its members every step of the way.